Hello, everyone. How's your day going today? It is Wednesday, October 9th, 2024. Today, we are really talking about something that I am very passionate about, helping people with fertility, helping them have a healthy pregnancy and have healthier children. And it all depends on the lymphatic system. Hi, my name is John Ossipinsky, aka Lymph Man. I've been working with the lymphatic system for 30 years, started as a certified lymphedema therapist, and became diplomat certified in craniosacral therapy, meaning I understand a lymph brain connection, but the lymphatic system is really connected to everything, every system in your body. And it's a system that we really never even think of. And we need to start thinking of it much more often. And then we start doing a lot better. All right, we're going to basically go over some information how to lower the risk of disease in children. And it really begins in the womb. It begins even before pregnancy, is when we really have to understand this science because we're really missing it. We are just not understanding how in the womb the baby is filling with cellular waste. And that's what's creating diseases like type 1 diabetes, right? It's really happening in the womb. And I'll explain that in a few minutes when we do some slides. Right now, I really just want to explain how I've been doing this. I learned from three world-renowned doctors, Dr. Upledger, craniosacral therapy. They teach it around the world. It's a wonderful therapy if you're not healing. But we really have to include the lymphatic system and your organs, right? So I learned visceral manipulation, how to release the organs from Dr. Burrell, a French physician. And then I learned about the lymphatic system from Dr. Bruno Ciccoli, lymph drainage therapy, theory and practice of lymph drainage therapy. And it's something that we really all need to know. That's your superficial lymphatic system. It's right under your skin, and we have it deeper in your organs, everywhere in your body. All right. So, understanding the brain, the organs, and the lymph system. And the lymph system is really what cleans every system in your body. So if we're not addressing the lymph system, and in pregnancy, we never think about it. When you're having problems with fertility, it's really the lymph system is not thought of. And when we think about helping children, for sure, we never think about the lymphatic system. And we really need to, because it is affecting us. It's starting in the womb, and then it's affecting us throughout life, not knowing that we are filling with cellular waste. Uh, it's basically science that's just emerging. It's coming out in science, but we really have to start addressing it, because even though it's coming out in science, I'm going to show you a great study that NIH just did, and what they found. We have to start addressing this earlier on. NIH will start talking about this in about 10, 15, 20 years. We need to start taking care of our lymphatic system now, and then we do much better. And the reason I care so much about helping children is that it's really what happens right before pregnancy. If you're looking to get pregnant and you want to try and conceive, you need to take a few months to sort of clean up, at least a few weeks. Really, I believe a few months. That's what Eileen and I did. Because we're filling with cellular waste, and they know that that's inflammation, and inflammation has been linked to infertility. So if we can reduce that waste, then we could do much better, right? And it's all about getting your lymphatic system, this tiny network of vessels and nodes, actually working. So let's see what else we got. Besides learning from the three world-renowned doctors, I'm a medical intuitive. I work with the lymphatic system for many, many years, 30 years, and about these 7 years in, I had an experience where I was working with a client and I saw these iridescent lines through the sheet, and I was like, what's that? And it was lymph flow. It was actually these lines moving through the body. And ever since that time, I can see lymph flow in people. It's crazy. But I'll get someone on the phone to do a session on them, and I'll say, let me look at your body first. I'll intuitively look at them, not with my eyes, but my mind, and I'll see things that pop out at me. And those are their worst problems. And then I can actually change my focus and actually see where their lymph flow is flowing and not flowing. And I see it like an X-ray, right? And the little white lines are starting to move through the body. So it's something that we really have to understand, this tiny network of vessels and nodes. I can help you in many ways. I can help you with a course. We have 2 courses. We have one coming up, a $97 course. It's a 4-week course that'll help you how to drain everything in your upper body. So if you have anything like acne, sinus problems, headaches, migraines, MS, you have eye problems, you have tongue problems in your mouth, dental problems, this is really going to help you, even doing your neck. We even drain inside the mouth, and I teach you how to drain in the eyes in that course, and it's really helpful. You'll actually feel circulation in your brain. So this is something that's coming up in a few weeks, so you'll see me doing it. I do want to talk about how I'm switching away from my email instead of sending out to the Ossipinsky Health Academy through MailChimp. I will be switching to in Kajabi I use, and I'm using the John Ossipinsky.com. So please hold on. If you want to get emails from me, I'll be sending out a VIP list in the next few days. Join it, and you'll gain access to my newsletter and blog that are coming up. All right, so let's go ahead. Let me explain a little bit about my sessions when I do them. And I work on pregnant women. I work on young children who have any type of cognitive problems or body problems like eczema or digestive issues. And if I'm working on a child, I work through the parent. The child could be in another room, another state. They don't have to be aware of it. They could be sleeping, but I'll work through the parent. The parent will also get some benefit from it, but so will the baby. And it's very gentle, but it is a way to get the lymphatic system flowing. So how I start is I tell people, okay, I'm holding your clavicles. Then I rock them. I turn them over and I rock their body, press on their legs. I turn them over again. I hold their clavicles, their abdomen. I start draining their abdomen, their legs, their arm. I hold their eyes. It's really it's the exact same session that I did in my office for many years, 26 years, called Lymphatic. I do it energetically, and it really is something that can make a difference, because some of us are just stuck, right? And it's really about cellular waste stopping our lymphatic system. All right, let's go ahead, and I'm going to just talk about one thing I'd like to discuss. Some common illnesses that we see, like cystic fibrosis, congenital heart disease in children, diabetes, type 1 diabetes, right? ADHD, or often a lot of kids, anxiety nowadays, children are having in massive numbers. We're having a lot of children with anxiety. Depression is also a big problem. And then we have some physical problems like hearing problems. They can have eye problems and lung problems, kidney, cerebral palsy, kind of a limb that doesn't function. And I believe every one of these things has to do with the lymphatic system, whether it's actually clearing waste out from the cells in a certain part of the body. And again, this begins in the womb. And understand that we're aging from when we are conceived. We're starting to age. And when a baby's born, they know that the thymus is already filling up with a little bit of fat that's right here. And by the age of 65, that thymus, they say, is unusable and not making T cells that are immune cells. And that's why we get a weakened immune system as we get older. But studies are also showing that if we can get movement and fluid going through there, get circulation going through there, then you might be able to help those T cells. So everything comes down to circulation in the body, everything. All right, so we basically need to see that this inflammation can happen from vaccinations. It can happen from within the womb. It can happen from birth, the baby just not cleaning well. Maybe it's a heart defect, but most children are, a lot of people say, oh, children are born pristine. I don't believe so. That's why children have severe diaper rash. That's a sign of severe acidity. Why children get eczema. Why children have problems growing hair sometimes. Children have problems with cognitive problems. Digestive problems. A lot of things going on that we're missing that really stem from inflammation, but it's the lymphatic system that has to clean that inflammation, and it's not doing it. So the lymphatic system is our body's sewage treatment plant and we need to sort of start taking care of that before pregnancy, when you're pregnant, and as you go through your pregnancy. This way you can avoid preeclampsia, because preeclampsia is a very, very serious problem that can affect the mom and baby. You get high blood pressure, you get pain, you can have protein in your urine, and it really is about your body just not being able to clear waste from it. Now, one thing I am passionate about this for, because me and Eileen tried for 13 years. We met in our mid-20s, and we were trying to have kids within a year or two, but it took us 13 years to have kids. And trust me, if many of you are like us, we tried everything. I mean, everything, and it just wasn't working. And if I knew the information that we know now about the lymphatic system and how it must clear acidic waste from our body, then I believe we would have had a much better chance of having children without having to go see a specialist. But I believe most people, most women are, and men, I'm not going to just say women because it depends on a man too. It takes two to tango. And I know my sperm count when we first started testing was like, I think 40 million, which isn't bad, in my 20s. And then we had it checked a little bit later. It was getting lower. It was much lower. And then when we decided to have children and go see a specialist, we cleaned up, me and my wife, for a few months. We cleaned up and we took herbs and all these things. We didn't know about taking care of the lymphatic system then, but we cleaned up. And my sperm count went to 150 million. The nurses came in the room, they were chuckling. It's something they don't see, they say, with 150 million. So again, if you have a husband who's having problems with sperm, it can definitely be helped by cleaning up the body and getting waste out of the body with the lymphatic system. Um, so there's hope. I like to give people hope, right? Especially when you're trying to conceive, because I know how that felt. It really was, especially for my wife. We both felt it, but she really felt it. It was for 13 years trying, and actually we took a little break in between. But we're thankful that we had our daughter through working with a fertility specialist, and I think Eileen just had some injections that she had to do, and then our son was born a little more than a year later, and without any fertility treatments. So by understanding the lymphatic system, I really believe it can make a difference in your life. Our organs sometimes just become stuck, they become tight, and we need to get them flowing. Another big thing, how many of you have children who had digestive issues? Let me tell you the story about our daughter was big in dance, and we went to a dance, just her practice, and there was a bunch of women there. Normally I was the only male, and and one woman was sitting there explaining to the woman how her child has to be scoped, may have to have surgery for digestive issues. And I had I understood acid alkaline balance then, and I said, "Do you know anything about that your body may be overly acidic and making your breast milk sour?" And she said, "No." She looked at me very leerily because the doctor had never mentioned this. And I asked her to come to my office. We checked her urine and saliva. She was severely acidic, probably close to 100 times more acidic than we're supposed to be. And to me, and we checked her breast milk. It was actually sour. And she said, sometimes it tastes sour when I taste it to check it. So it's a problem, right? All of our children, maybe not all, but a majority of our children, if you're not watching your diet, are starting with digestive issues because they're getting breast milk or maybe just formula, right? Breast milk is much superior to anything else, but we have to get our body more in balance, eat more greens, have more water, do a little exercise, right? Everything we do in pregnancy, we do very little, very slowly, so we don't make the body more toxic, which can affect the baby. So be aware if you know anybody who's having a baby with digestive issues. It may, if they're breastfeeding, it may be, or that they had breastfed and the intestines become very acidic, they may have to sort of take steps to balance. And if they're breastfeeding, it might be taking supplements through themselves, taking magnesium and some other supplements so that the baby will get those nutrients too. A good way to clean up between vaccinations is put your child, if you do vaccinations, and I don't, that's up to you. If you do vaccinations, you have to clean up with your child because each vaccination, just like the COVID vaccine made people sick, every vaccination, your body sees it as a problem and it says, I have to go fix that. It sends out immune cells and if it's certain types, it's going to ramp up the immune system. And when we do that monthly and we do that for 15 months, the children end up having brain problems. And it's because of the constant inflammation that's going on all the time, right? That vaccination and a little bit of a inflammation that happens, and then they do it every month or so, and the child actually starts filling up with waste. And we know that waste affects the brain. We get anxiety, we have cognitive loss, we have many different problems. So clean up your child, but between vaccinations, put them in a couple of Epsom salt baths, not too hot. You put a cup of Epsom salt, 2 cups of Epsom salt, and you let them soak, and it really makes a difference. You have to sit and watch them, make sure they're with you. If they're young children, you can take them in the bath with you and hold them and just put them in for a few minutes, maybe 5 minutes, 3 minutes, right? Because they don't have the fat in the body. So it'll affect them faster. So just put them into a little bath with you is the safest way. You can hold them and just for a few minutes and then have your partner take the baby. See if there's anything else we have to talk about today. We'll talk about dietary stuff in a minute. All right, let's go ahead and start our share. All right, go ahead and get going. Get some water if you like. Watch your posture because posture is really key. You slouch a little bit, you sit in front of a computer all day, where slouch and it really sitting or standing, it will slow your lymphatic system. So your lymphatic system is a plumbing system, right? And here we're talking about fertility and pregnancy. Children are in the womb for 9 months, not moving much. So it depends on the mom, and we're going to see a study on that. The mom has to do some movement. And I know when my mom had me, the woman would coffee clutch. They would sit, have cigarettes and coffee because doctor said, yeah, cigarettes are good for you. So we made it through that. You know, our kids are resilient, but if we can start them off life with a little bit of movement in the womb, a little bit of healthier diet, fluids, and less stress, right? Manage the stress, our kids will do much better. But think about the baby in the womb, right? If the lymphatic system can't be cleaned, can't be cleaning, then waste is going to build down in your body and in the baby. And especially since the pressure of the baby can sit back onto your major lymph vessels and actually stop lymph flow. So movement, stretching is very gentle stretching is very important to get lymph flow up the body because the major lymph vessels are right here in your neck, one vessel on either side of your neck. If you're going to breastfeed, right, we want to make sure this is flowing the underarm, and because the breast flows to the underarm, but it also has to flow up to here. So if this is blocked here, then the underarm's going to back up, and then the breast can back up. And when you breastfeed, you can start getting mastitis or other problems. So we want to make sure the shoulders, by doing the lymph man shoulder shuffle, you'll learn we have to do that when we're pregnant, and then we do a lot better. We are always opening up the lymph system 2 or 3 times a day, taking some deep breaths just to pull waste through the system. Every time you take a breath, a deep breath, you pull waste through the system, and we make pressure in the body. Very, very important. It's called intrathoracic pressure. So why you should maintain your lymphatic system to help fertility, pregnancy, and children, right? Because inflammation is a major cause of most diseases, and we need to address that inflammation, and we do it with our lymphatic system, the body sewage treatment system. Check with your healthcare practitioner before you do anything to improve your health with what I say. And never stop a medication. I always get people online saying, oh, I'm going to stop my meds for anxiety now that I know how to do this. Don't do that. It could be really bad for you. Always work with your physician, get yourself healthy for a few weeks or a month or so, and then talk to your doctor about weaning off. It's a much safer way. So your lymphatic system is your body's sewage treatment system. Fluid we see, everybody's got a little fluid, even if you're slim, have a little bit of fluid in your body, the under your skin, around our belly. Often it has to remove fat. So if you have fatty liver, fatty tumors, it's basically, if you're overweight, it's because your lymph system isn't cleaning it. But it's really the buildup of cellular waste, parts of cells that are like log jams in a river. Fibrin is also like a yarn that can fill the body and it makes it hard, even your organs. But it's a lot of waste from hormones, carbon dioxide, too many white blood cells, toxins, bacteria and viruses, especially with the COVID. But whether it's the common cold, the flu, it's all the same. They fill you with cellular waste, and nobody's told us that before. And when you have those repeatedly, it can affect your health. But even cancer, if your lymphatic system is not flowing, this is a superficial flow. This is a deeper flow in your organs, your blood vessels, your muscles, everywhere. And it can't go after cancer, bacteria, viruses. It can't go after fat if it's not moving, right? The lymph system has to flow, and then your immune cells become much more active. So if we want to have a healthy pregnancy, we really have to think about this system, right? We have to think about the system that's cleaning the mom, and the child, right? A lot of times people say, oh, there's protection for the baby. Limited protection, right? Mom has to really make herself less toxic, and then she'll do better. The baby will do better. So this is a report I'm showing almost every week now because I published work a few years ago on how most diseases due to the buildup of cellular waste in the body because your lymphatic system is not working. And guess what? Emerging Science, this is an NIH report, the emerging importance of lymphatics in health and disease, an NIH workshop report. And I'm going to show you all the diseases that they're going to start researching, and a lot of them they are. But what they found in this report, and I'll put the link in a little while, changes in normal function can alter multiple systems in the body and manifest as different and varied pathologies. There are many conditions related to lymphatic dysfunction, right? Dysfunction of your lymphatic system within all body systems. And that's because the lymphatic system cleans all body systems. So when our little vessel in our neck shuts down, or we have 3 vessels in our abdomen have to clear the lower body, then we're just going to back up with waste, right? But it really depends on your upper body. So this is not me saying this. They're just verifying what I found is that dysfunctional lymphatic system is really the root cause of most disease because it can't clear waste from your body. So this is what they found, right? Yet to be charted lymphatic system in health and disease, central nervous system. So they talk about brain injury, Alzheimer's, cerebral small vessel disease, hydrocephalus in children, cardiovascular heart failure, pericarditis, arteriosclerosis, hypertension, which is high blood pressure, urologic diseases, so kidney, renal lymphangiectasia, swollen lymph nodes in your kidney, nephrotic syndrome, chronic cystitis, polycystic kidney disease. I mean, I can go on and on, even cancers, all the cancers. And they didn't list the blood cancers because they said, well, include the blood cancers, but it's just that they didn't include them. But anything with the skin, lymphedema, lipedema, scleroderma, dermatitis, eczema, aging, right? Hair, eyes, anything with the eyes, anything autoimmune disorders. So it's basically everything. Pulmonary, COPD, pulmonary fibrosis, GI systems. I had IBS for 30 years, and it went away 12 days after starting to clear up. All right. It really felt very different. Diabetes, obesity in the GI system. MS, when we're talking about the autoimmune, rheumatoid arthritis, Sjogren's disease, lupus. It's really everything. It's every problem we have. Fibromyalgia, you can't ignore this. Now, this is NIH that said this, not me. But they'll, even though they found this and they're going to be researching this, it'll be 30 years before you really know what to do from the medical system. So you need to understand that. And that's why you need to come back and listen and keep on hearing it from me. So this system must clear us. And if it can't, wherever it can't clean us is where we're going to get disease. Wherever you have trauma, wherever you had surgery, wherever you had, you don't sit straight all the time, that area is not going to flow as well. So make sure you're watching your posture at all times. So we have a superficial, which is what we see here, lymphatic system. And if it can't clean you, you're going to get little bumps around your nose, cold sores. You'll get a fatty little growth in your eye. You get ear tubes where you may need fluid because of, you may need ear tubes because of fluid in your ears. You lose your eyebrows because waste is building in the hair bulb. Same thing with your hair. But if you have any brown blemishes, any type of beauty marks, that's cellular waste that built in your superficial lymphatic system. I have 3 blemishes on one side of my face, not the other, because this side is not flowing as well from surgery. But the system must clean us, and it's not. And it starts in the womb. And think about the baby sitting just tight, very tight for 9 months. And that's why mom has to do some gentle stretching and movement and deep breathing to help flow through the baby. And we're going to see science on that in a minute. Now, if you want to have a child who can think clearly, it comes down to an acidic brain. This is just found recently, April 2024. Brain acidity linked with multiple neurological disorders. In a global research effort, scientists have uncovered a relationship between, there's like 135 scientists, problems in the brain, metabolism problems in the brain, how it clears waste, and a range of neuropsychiatric, neurodegenerative disorders from autism to Alzheimer's, as well as depression, epilepsy, schizophrenia, you can include anxiety, intellectual disability, and bipolar disorder, all involve a degree of cognitive impairment. Animal models representing depression induced by stress, diabetes, or colitis, all of which lead to higher risk of depression. They displayed a consistent pattern of decreased brain pH and increased lactic levels, meaning as the brain became more acidic, it filled with more waste, right? So if the body becomes acidic or the brain becomes acidic, it stops the lymph system from cleaning. And there are over 600 neurological disorders. And I can tell you, eventually they'll all be, really all of our diseases are going to be linked to acid in our body or our brain. That's what I published over in 2006. So here now it's coming true. They found out that acid in the brain is creating I'm sorry, it's a nervous laugh. To me, it's like unbelievable. And then we just saw a study how lymphatic system is really being linked to every disease. So if you want to have a healthy baby, it's really about movement. Flow means go for proper lymph system development. Findings in mice hint at new approaches for treating lymphedema and other chronic lymphatic disorders. And I believe every disease and disorder is a chronic lymphatic disorder. The lymphatic system provides a slow flow of fluid from tissues into the blood. It returns fluid and proteins that leak from blood vessels, provides passage for immune cells from the tissues to the blood, and hosts key niches for immune cells. How this system develops hasn't been well understood, and that's key, but now researchers have found from that the early flow of lymph fluid is a critical factor in development of mature lymphatic vessels. Once the primary lymph vessels are in place, an enormous amount of maturation has to happen. And what we found is that the maturation process is triggered by physical forces from the earliest flow of lymph fluid in a developing embryo, meaning have to have flow through the baby. The baby's the baby in the womb, its lymph system grows to a certain point, and then if you want it to grow better, to go deeper into the body, to be able to function better, then you have to do movement. You have to create forces in the body. That's key. So if you know anybody who's pregnant or want to become pregnant, tell them some light exercise is key, right? Not intense exercise, but light exercise. This is big, right? Fetal brain impacted when mom fights severe flu. New mouse study explains how. New research using live mouse adopted influenza virus improves upon previous mouse experiments to explain how maternal infection impacts fetal brain development. The study also indicates that fetal brain changes are more likely once the severity of the mother's infection meets a specific threshold. Meaning what they're seeing is that when the mom has a flu, and it's just like COVID, it creates cellular waste. They know that flu, common cold, all creates cellular waste, that when the flu gets severe enough that it's going to affect the baby. Researchers tracked how the infection progressed in the lungs and intestines of the mother, as well as how products from the mother's immune response interacted with the fetal brain. They also measured the physical properties of fetal brains, including the thickness of the cortex, which has been linked to neurodevelopmental disorders in humans. The team tracked immune cells in the fetal brain, microglia, which infiltrate the brain and interact with developing neurons, had signatures of increased inflammatory activity in fetuses from high-dose flu-infected mothers. So again, the thickness of the cortex, things thicken because the lymph system can't clean them. So it's very important if you're pregnant and you have the flu or a cold, that you clean up a little bit, that you make sure you're doing some movement, make sure you're hydrating, very important, maybe taking a little magnesium to improve the lymph flow because it helps to relax the body. Type 2 diabetes. And again, type 2 diabetes, they know it's when the pancreas fills with cellular waste and it damages how the pancreas makes islet cells, which make insulin. That same thing is happening in the womb, right? Type 2 diabetes, they don't know what's causing it. Same thing is happening in the womb, right? That the islet cells are being damaged. It's just happening in the womb. So movement is very, very, very important. Removal of zombie cells, which are these zombie senescent cells that they no longer replicate. They're just sort of not being taken up by autophagy or metabolism, and they're just congesting our body. And when they removed these in mice who had diabetes, the diabetes was alleviated or went away. So that's that's big, right? So we have to it all comes down to these senescent cells. That's what I talk a lot about in my course and what I talk to people in my coaching calls. It really makes a difference when we understand that we're filling with zombie cells that are just filling us up and limiting circulation, and they actually give off a component that damages the cells around them, and that can create an autoimmune disease or more severe illness. Researchers have shown that when senescent cells, also known as zombie cells, are removed from fat tissue in obese mice, severity of diabetes and a range of its causes or consequences decline or disappear. Our findings show that senescent cells are a cause of obesity-related inflammation and metabolic dysfunction, and that senolytic drugs hold promise as a treatment of these conditions and their complications, which include diabetes. Mayo Clinic did another study, not just with diabetes, where they were able to be alleviated by getting rid of senescent cell. They did that with anxiety. They saw mice had anxiety. They bred them to be that way. They removed senescent cells and fat from their body and their brain, and the anxiety went away. But it's not that easy, right? It really takes time to change your cellular environment, and that's what I am the master of, using the lymphatic system, diet. It's not just about drainage. We can't just drain, and we have to be very careful when we're pregnant. You don't want to start draining yourself. That's going to release waste. It's going to make you more toxic, which can affect your baby. So do not start just say, oh, I'm going to learn how to drain myself, and start draining yourself. The whole process when you're pregnant to really start slowly, change your diet, drink water, do a little light exercise for a couple of weeks. All right, breastfeeding is crucial to reshaping infants' microbes and promoting lung health. Human breast milk regulates a baby's mix of microbes or microbiome during the infant's first year of life. This in turn lowers the child's risk of developing asthma. Stopping breastfeeding earlier than 3 months disrupts the paced development of the microbiome. That's where your microbiotic your biotics, your microbiotics are, and it's where they live, and was linked to a higher risk of preschool asthma. So again, these bacteria help clean, right? The study authors noted that beyond aiding in digestion, an infant's microbiome plays a crucial role in the immune systems, which is your lymph system's development. So try and breastfeed at least for 3 months, 6 months if you can. You have to be well hydrated. You have to be more balanced in your body, and baby needs it. It's the way baby gets a lot of its nutrients and a lot of its immune cells, right, to get it active. We need to teach kids the importance of daily exercise. When my kids were younger, it was my job was exercise. I take them to the park, have them run around and chase me. We chased the dog, or we'd play games where we would run around. And then as they got a little older, we rode bikes all the time, right? We'd ride bikes at different parks. So you have to take an active part in your child's exercise, and that way you're doing it with them. It's a nice way to bond. Hours of inactivity during childhood could be setting the stage for heart attacks and strokes later in life, according to new research. The study found that sedentary time accumulated from childhood to young adulthood in the 20s was associated with heart damage, right? Even in those with normal weight and blood pressure. So I've read studies years ago on how they're finding in accidents, when kids have accidents and they die, they find arteriosclerotic plaque in them. So we're filling with waste early on in life, and we're just not seeing it until later in life when it starts affecting us. Children were sedentary for more than 6 hours a day, and this increased nearly by 3 hours a day by the time they reached young adulthood in their 20s, 9 hours a day. Our study indicates that the accumulation of inactive time is related to heart damage, regardless of body weight and blood pressure. So it's really about immune clearance of these senescent cells. They're cells that are sick, and we don't want them in our body. And it has a lot to do with whether our lymphatic system can help make healthy stem cells to repair these senescent cells or to make new stem cells. But targeting cellular senescence in metabolic disease, and every disease, even pregnancy, we have to understand about metabolism. How's your body breaking down waste? Cellular senescence can be pro-inflammatory in aging and obesity. Senescent cells accumulate in many tissues, including adipose tissue, brain, kidney, pancreas, and liver. These senescent cells and their downstream effects appear to perpetuate inflammation and have been implicated in the pathogenesis of metabolic dysfunction. Increasing immune clearance of senescent cells holds significant promise for treating metabolic dysfunction in multiple tissues and disease states. So it's really even about aging. They find getting rid of these senescent cells, that's what is making us age. So if you want to age nicely and gracefully, you have to really include getting rid of this waste, and we do it with the lymphatic system. So we are in a new era of the lymphatic system, right? No longer secondary to the blood vascular system. The blood system has been studied extensively. The lymph system, they just started really studying it a lot because now they can see it with special imaging. So I would say in the last 10 years, it's really starting to come to fruition. And now we see that NIH really is going to do a lot more research on it, even though they have been spending millions on the lymphatic system. So it's something that you need to take care of. We can no longer ignore, especially if you're pregnant, right? Because 500 million cells die in your body every day. Waste is building in your baby's body every day. And if you don't move a little bit, not too intensely, just move, go do some light exercise, some walking, a little bit of stretching, a little bit of light weights would help, but don't do too much because that will push out too much waste at the beginning, and it'll make you more toxic. All right. So the authors on this article, they said, we hope to convince readers that the lymphatic system is no less essential than the blood circulatory system for human health and well-being. All right. I'm going to stop that for a minute. Okay, let me see what I have here. I am going to, sorry. No, not that one. Okay, guys, I'm going to do, well, I'm not going to put anything up, but I'll check it. I apologize. Let me see if I have my email here. I have it in the other computer. And if you give me a second, I'm going to go ahead and get it in my email. Just take 2 seconds. And that way I can give you all of the studies. I want to give you all of the studies. It'll take me 2 seconds. All right. So it's really important to understand that this is real science. I mean, I understood this 30 years ago. I started learning about the lymphatic system and the importance of it. And then at one point I realized, wow, because we don't miss the lymph system, we're filling with cellular waste. Let me put some information here in the chat for you, if anybody is on. Let me put this information right here for you. And it will be in our email tomorrow. I'll put this stuff out. Let's go ahead and finish up. So what do you do for diet, right? How do we change the breast milk to be healthier, not to be acidic? You eat more greens. You got to eat a lot more fruit, vegetables, cruciferous vegetables, some nuts, right? Like cashews, maybe some almonds. But really, it's mostly eating a lot of green leafy vegetables. You make that your goal. Eat a lot less beef, a little bit of fish, chicken, turkey, and take magnesium. Magnesium helps your lymph flow. It relaxes your body. It'll be very important. A lot of times during pregnancy, when women are at the end stage, they have to give them magnesium because the body is having problems. So if you have more magnesium in your body, you'll tend to have less problems, and you'll probably have less stretch marks if we have more magnesium in getting rid of the acid waste that's in our tissues, because that's what stretch marks are. They're really a weakening of the tissues, right? They're not able to be pliable because they're overly acidic. So I'm going to show you how to basically do the Lymph Man shoulder shuffle today. It's very, very, very simple. We just put your hands on your lap. If you are in a dangerous pregnancy, maybe just start changing your diet a little bit, drinking more water. Don't do anything intensely, but everybody can benefit from this. And I want to show you how to do it for a child. If you have a child at home, a little infant, right? They're in the bassinet or whatever, the crib, and they can't really do the Lymph Man shoulder shuffle. You can just put your hands on their shoulders and just move them up and down. And that, right? Think about it. Kids were in bed in your womb for 9 months, and then they're lying still. And don't papoose them. Don't wrap them up too tightly. That can limit how they breathe, and then that will limit how their lymph flows, because breathing is what moves the lymph flow. So when you tighten children up, don't make it overly tight. That can actually make problems for them. So hopefully this makes a difference. Understanding these little things that I'm teaching you, but the Lymph Man shoulder shuffle is key. And we're going to do it right now. I'm just going to put our hands on our knees. If you're standing up, put your hands in front of you, or even on the baby if you have a belly, and just move your shoulders a little bit. Remember, the major lymph vessels are right here in your neck. There's one on either side. And all of the waste and fluid and fats have to go into that. And they get clogged up, especially if we sit forward. If you slouch when you're pregnant, you're going to make it worse. So make sure you're watching your posture. And this is about 20 or 30 times, right? Nice and easy. Another thing I want to show is you can put your hands on your clavicles. Your clavicle is the bones in the front of your neck. Just put a thumb on one side, 2 fingers on the other, and rest your hand gently on your chest with no pressure, and just hold it there. If you're watching TV, put a pillow underneath your elbow and just hold it for a few minutes. But I just hold this now. I feel relaxed, right? If you're pregnant and you get stressed, or a person who gets stressed, because everybody has a little anxiety sometimes, do the Lymph Man shoulder shuffle a couple of times. Take a few deep breaths, wait a few minutes, do it again. when we're having anxiety or even depression post the after pregnancy, it's because you've become filled with waste. So we need to open up the lymphatic system, slowly change your diet and get that waste moving through, but you have to get the lymph system moving a little bit better. Even deep breathing will move lymph through you and the baby. So just sitting, taking 20 nice, relaxed, deep breaths, maybe build up to that, will make a big difference on how you flow. All right. If anybody has any questions, you can put it into the chat or into the question and answer. It's really something, this is my passion. Too many children are having major problems with how they think, from autism spectrum disorders, and it's a very wide spectrum, cerebral palsy, ADHD, and even seniors, right? We're losing our ability to think as we get older. But many people have anxiety, depression, bipolar, and it's because we've missed the lymph-brain connection. And simply by opening up this area here, we help our brain flow and our body flow. All right, everybody, I appreciate you guys for showing up. I will be having this up soon. I hope this makes a difference in your life. I actually may be putting this even up into YouTube. So if anybody's missed this, if you want some friends to look at it, I may be putting this one up in YouTube. I don't put many, but I really want to help people or parents have healthier children, and I know this can make a difference. All right, what can I do for infertility at 48 and have chronic fatigue? All right. Number one, you have to balance your body. If you have chronic fatigue, it's because your body doesn't have the oxygen. And oxygen has to do with whether your body's acidic. When your body is acidic, number one, your lymph system can't clean, but it's also, it can't hold oxygen. They know this, right? When your blood's acidic, it can't hold oxygen. So then you can't make energy. So I would say you have to get your body sort of cleaned up, and that's what I help people do. If you want to, I also do not just courses. I help people in coaching calls, where I tell you what supplements you should do. I show you a few different things. I don't show you a whole routine. That's what we learn in my course. But having my guidance and having me in that, will also do a distance lymphatic healing session. Having me open up your body, you'll feel flow, I believe, can open you up. Some people have just had stress all their life. They sat over a computer and they've limited flow out of their abdomen and pelvis. So we need to correct that, and then people do much better. But it's really about cleaning up, Vicky. We have to clean up. Take a little bit of time and just start understanding that it's about diet, cleaner, greener diet, taking a little time to drink a lot more water, taking a little bit of supplements, and we need to get rid of that waste. And then your body, you'll start having energy, and your body, again, will be able to support the cells that you want to, again, put into your body and have it sort of thrive. All right, everybody. Vicky, I hope that helps. Again, hope you guys have a great day. If you know anybody who's pregnant, please tell them about it. And if you have any questions about the distance lymphatic healing sessions or our course that's starting in a few weeks, let us know. All right, everybody. Have a great day. Bye.